Amit, as a member scientific, Amit, you are doing a fabulous job. Could able to see your hard work in SSTC also. In my direct job, I am struggling and not able to get a good crack. So how do I deal with? So no financial interest. So why direct job? Because it's always efficient. As Amit said that it divides the nucleus in natural plane of cleavage. Definitely there is a reduction in the fake energy, enhanced safety, better control of the nucleus division, it's more adaptable, less ultrasonic time. So coming to the direct chop, I think we all know that very simply to say that there is a horizontal chop and there is a vertical chop. There are a lot of chops has been described in the choo-choo chop, different chop, but just remember horizontal and vertical chop. So horizontal chop probably, according to me, it is more suitable for soft to moderate grade of cataract. Normally, we prefer a blunt tipped chopper, that is like a Chang's chopper or Lieberman chopper. So now my talk is today, if I am doing a horizontal chop, nucleus is not cracking, what I should do? What are the reason for this? Improper placing of the chopper, not impaling deep into the nucleus, and impaling peripheral epinucleus instead of nucleus. These are the three problems you may have, and finally you may land in this problem. See, I am just showing you a video. See, you can see here, holding the nucleus, go just underneath, it's a blunt chopper, but still could not able to crack so much. Still it has been cracked into a half piece, not exactly full piece. So most of us, we try to finish off the case fast. Come on, let us do it. Don't make into a minimum 4 to 6 pieces that make your job easy and that also save your endothelium. That is very, very important. Because every time each pieces comes on, sometimes these all nucleus pieces may hit the endothelium. It may chatter within the antechambers. It may cause a endothelial damage. So then there is one more case I am just seeing. This is a patient with a mature cataract. It is a sort of a Morgaginian cataract. You can see the chopper. It is not exactly a blunt, not tipped one. It is not exactly sharp. It's a somewhat semi-sharp chopper. Go inside. You try to crack. Then it is like trying to do somewhat vertical, in between trying to do something called horizontal, because surgeon is a bit scared. So just go inside, try to crack, not able to crack that much, even though nucleus is of grade 2, grade 3. So always you should go with a blunt chopper, go with a one shot, then you try to divide, then your job is going to become much, much easier. Now you turn the piece around, then I think you can chop it quite easily. So selecting a proper chop for particular case is at most important. So this is a case of, again, case of a hard nucleus. You could see the surgeon who is embedding the nucleus, not exactly, is going much far ahead. Try to go inside. Still he could not able to crack it. So the ideal case scenario for this one, do a vertical chop. So he is trying to do the horizontal chop, struggling. See, if you struggle many a times, especially grade 4 cataract, chances of damaging the zonules also much, much higher. So struggling, then you could able to get a somewhat average chop. Once the chopping done, I think you can do. Again, I am insisting here, try to make it more pieces. So this is the one more video of how we exactly do the horizontal chop. You can see the chopper around there. Go within the substance, wherever it is harder side. Always try to select exactly at the entry itself. Try to impale the nucleus. Go underneath the nucleus and you try to chop in such a way that then it will make exactly into two halves. This is how you have to do. Then most of your job is over, and whatever that energy, whatever you use, which is going to be much, much less compared to the, if you do a improper horizontal chop. So as I said that, impale deep in the center of the nucleus, very important. Go under the rhexis, hook the equator, very important. Move the chopper towards the probe and with the lateral separation. So coming to the vertical chop, normally separating the forces acting in a vertical direction, which can be done even in the case of small rexis, and even you can try in the small pupil also. So vertical chop, grade 4 cataract, small rexis, small pupil, the best thing. But you have to take always sharper chopper for vertical chop. The most common one is most of us using Nagara chopper. There are Agarwal's karate chopper. Even my friend Mohan Rajan chopper is also available. So what are the reasons for not achieving good crack? The one is inadequate tip exposure, very important, not buying deep into the nucleus, not having a good vacuum. So you need to have a very high vacuum, around 400 millimeters of mercury. Always using the blunt tip chopper, or I always feel a sharp chopper. So this is the case I am just showing you about the vertical chopper. Go impale within the substance of the nucleus, then you try to chop. But here the surgeon is trying and not able to chop it properly. That means the chopper is not going within the substance of the nucleus. So he is trying to chop, but the simultaneously with the 5-6 attempts, then he could able to have this chop. So this is very important. Go within the substance, even with the probe and the chopper, then you could able to have a very good chopping technique. Once it is done, again I am repeating, even in vertical chop, when you are dealing with a grade 4 cataract, try to do minimum 6 to 8 vertical chops. Then so you can even have the center core first, then followed by the remaining pieces quite easily. So you can see here the chopper, this is a Mohan Rajan chopper, very sharp, sharp tipped chopper you can see. See, if you are having a very good chopper, initially the beginners may be little bit afraid by seeing the chopper. Once you become the best, these choppers will do wonders for you while doing. See, even though a lot of struggling he is doing, because he is not embedding. So how you have to do correct way, go within the substance of the nucleus, then go like this. This is the correct way to chop, okay, into the 2 halves, then you try to rotate, then you turn. This is the correct way to do this vertical chop. So you can see here, it is embedded nicely, and you could be able to have a more pieces. Then later on, if the center core is hard, try to hit the center core first, then followed by the other pieces around. So this is the last case I am just showing you. It will take half a minute, Amit. This is a case of a vertical chop. So you can see the chopper, it's a sharp chopper, but it's not so sharp compared to this Mohan Rajan chopper. So it's a sharp chopper, but the tip is not too long. So especially patient with a grade 2 to 3, you can try this and you can come up with a very good chopping technique. So you can see, make into more pieces, try to eat. In such cases, the amount of damage what you do for endothelium is endothelial loss is going to be much lesser. So this is the last video I am just showing you. This is a patient with a very grade 3 cataract, but it is a brown cataract. You could be able to see a good red reflex. Try to make into different halves, and you can eat quite easily. It looks like it's an immature cataract, but it is not immature cataract. It's a grade 4 cataract. So make into more pieces, then you try to have, then you can get the nucleus into the tip quite easily. So take home message, make sure that adequate tip exposure as per the grade of the nucleus. Start sub-incisional so that you will reach the core of the nucleus easily. So the key is start at sub-incisional so that you will reach the core of the nucleus easily. Impale sufficiently into the depth of the nucleus. Chop when adequate purpose of nucleus is confirmed. Bring second instrument linearly towards the probe, then to the lateral separation. Patience is the key. I thank again my brother Amit Porwal this wonderful opportunity. Thank you one and all.
Thank you, Dr. Kudlu. So for the audience, this whole course is totally going to be video-based teaching. There's nothing going to be theoretical talk. So very wonderful, Dr. Kudlu.